Hi.
My name is Dr. Semide. What is your name?
Ozzy.
Nice to meet you.
Nice to meet you.
Okay. So Ozzy, what are you coming in for today?
Yeah, I went out for a run today around 8 a.m. and I don't know what happened. I got home and I just don't remember the run at all. It's just 2 hours of blankness, pretty much.
Okay, so at 8 a.m. you went out for a run, and then
I don't
no
remember
memory.
anything. Exactly.
Interesting, okay. And that went on for about 2 hours?
Around there.
So 2 hours later, what did you remember next?
Well, I was at home and I was with my partner and we were just lounging around on the sofa.
Okay. Have you ever experienced anything like this before?
Not to this extent, but I've had a history of migraines in the past, yes.
So you've never had any kind of memory loss, amnesia in the past?
No, not that I recall.
Okay. What did your partner say what happened? Like, how did you get home, according to her?
I just walked in and she said that I looked kind of off and I just sat on the couch and there we were.
Was there anything else about looking off? Was there any kind of loss of consciousness, or
From her?
like, did she notice that you had any loss of consciousness, or if there was any like slurred speech, anything like that?
Well, she did say I looked kind of off and my voice was not normal in particular.
This is not normal. Okay, we're going to have to talk to her about this as well, but did you have any trouble speaking?
Not in particular, no.
Did you have any weakness in your body, according to her, like in the arms and the legs?
No, she didn't say anything like that.
Okay. Was there any numbness, particularly in the face?
Nope.
Any drooping in the face?
No drooping, no.
Okay. Did you have any headaches or migraines leading up to this, during the episode, according to her, or afterwards?
No, she remembers me getting out of bed and then I went out for my run. She didn't notice me off before that.
Okay. Do you have any memory of passing out?
I can't. No, I don't remember.
Do you have any memory of being dizzy, lightheaded beforehand?
Not beforehand, no.
Okay. I can imagine you must be a little bit scared right now.
Yeah, like this is all very new and I'm a bit worried. Yeah.
It's never happened before. Okay, so the big thing that we're ruling out here is stroke. I don't want you to worry though, you're in good hands. I'm going to make sure that we go through all the labs and all the testing that we need and the physical examination so that we can try to rule this out. You are young, so it's hopefully it's not too much of a concern, but it's always the first thing that we look at. I'm going to ask you a few more questions. So you said it lasted 2 hours. I'm going to have to talk to your partner, maybe just get on the telephone with her later and talk about this. Can you tell me about your past medical history? Other than the migraines, do you have any other health conditions?
No, not anything other than migraines, no.
Okay. And can you tell me about your migraines? 1 being like a very mild headache, 10 being the worst headache you've ever had. How would you rate your migraines?
The one that I just had or the ones that I've had?
The ones that you've had in the past, yeah.
The recurring ones, they range anywhere between a 5 and a 7. Like,
okay.
I have like a throbbing kind of feeling to it.
Throbbing. Which side is it?
Left side.
Left side, okay. Do you have any symptoms such as like any visual symptoms, blind spots, light flashes, any kind of aura?
When I get the migraines, I do see like some kind of blind spots here and there.
Okay.
Yeah.
Have you ever had any slurred speech when you have migraines?
No.
Any other symptoms at all with the migraines?
Nothing too noteworthy, no.
Okay. Do you take medication for them?
On occasion, if it does feel really terrible, then I'll take an Advil.
Okay. All right. Are you on any other medication other than the Advil?
No.
Do you drink alcohol?
Socially.
Socially? How many glasses and how many times a week?
Well, socially would be for me maybe once or twice a month, and then during one sitting maybe I'll have 2 or 3 beers.
Okay. Do you use any recreational drugs?
No.
Do you smoke?
No.
Okay. Do you drink any caffeine? Coffee?
I have a coffee a day.
1 coffee a day. What's your family history of diseases? So, your parents, your grandparents, siblings?
Well, my dad had cancer, and one of my uncles had cancer as well, and my mom has high blood pressure.
Okay. Any history of brain cancer, brain tumor?
Nope.
Okay. Let me see if there's anything. Is there anything else you want to add to this? Anything else that you've noticed that you want to bring up?
No.
Okay. Alright, and I'll keep asking you questions throughout the exam as well. I'm going to start off by taking your blood pressure. And your temperature. I'm just going to insert this under your tongue. So just open your mouth, under your tongue, close your mouth, and just hold it with this arm, this hand right here. I'm going to take your blood pressure using this arm. Going to have you relax down here. Good. Sorry. Just check. 6.85. Have you had any fevers in the past month?
No.
Any infections, any signs of infection?
No, nothing like that.
Okay. I want you to relax your arm down, just completely look up. Okay. Blood pressure is 110/70. It's very good. So, I'm not concerned about low blood pressure or any hypertension.
Awesome.
Have you been drinking enough water during your running sessions?
Maybe I should be drinking more.
Okay. How many glasses of water roughly do you drink a day?
I would say 6, 7.
6, 7? Okay, it's not too bad. Alright. Just gonna take your pulse. you. Okay. Right. So, did you notice any sort of trauma to your head or any part of your body? Did you notice any bruises, any kind of injury after this episode?
No, I didn't have anything like that I can see on my own body. Maybe it might come up in a few days, but nothing right now.
Okay, and I'll make sure to check your skin and your head as well. I'm going to ask you a few questions. So, where are you right now?
I'm in your office.
Who am I?
Dr. Semide.
Okay, thank you. Who are you?
I am Ozzy.
Okay. And why are you here?
I experienced the memory loss after I came back from a run.
Okay. What day is it and what time?
It's November 10th of 4:15.
Okay, thank you. Can you subtract 6 from 100 and then keep going?
I'll try.
Okay.
So 100, 94, 88, 82, 76, 70.
Okay, that's good.
Awesome.
Can you spell the word cognition backwards?
Okay. NOITINGOC.
That's very good. Okay. Alright, Ozzy, I'm just going to be checking your skull for any signs of injury or trauma. Let me know if you feel any pain or tenderness as I'm palpating it.
Okay.
Okay. Now I'm going to percuss all over your skull again. Tell me if you feel any pain or tenderness.
Okay.
Okay, and now I'm just going to palpate your neck. Let me know if you feel any pain.
Okay.
Sorry, actually, for this part, do you mind just
Sure.
turning? Yeah, thank you. Okay, can you bend your head forward?
Yeah.
Your neck, yeah. And back. Yeah. Go ahead, go as far back as you can. Is that okay?
Mm-hmm.
Now we're gonna go to the side this way. Like turn, yeah, you can do a rotation as far as you can, other way. Okay, now you're going to just do this, so like sideways, yeah, and then the other way. Okay, you seem to have a little bit of limited mobility, but it's not abnormal.
Okay.
There was no pain when you did that?
No.
Okay, you can turn and face the front again. I'm going to do a quick check of your skin, so if
Sure.
you don't mind. Just to make sure you didn't fall and hit yourself anywhere. Okay. All right. We're going to go ahead and start the cranial nerve exam.
Okay.
So I'm going to have you smell a few different essential oils and you're going to tell me what you smell.
Sure.
Please close your eyes.
Smells minty.
Okay, thank you. Does that smell like?
I don't know. I think a bit lemony.
Okay, very good. Alright, Ozzy, I'm going to take a look inside your eye. I want you to just look straight ahead, right at that wall.
Okay.
Okay. Are you feeling okay?
Good.
Alright. So that eye looks completely fine. Let me look over at the other one. Okay. Just looking for that red light reflex and then taking a look closer. Okay. Alright, I'm going to do the exam again on this side.
Okay.
And I want you to look, just for 1 second, look directly into the ophthalmoscope.
Okay.
Okay. Good. Let's take a look here. Alright, so I took a look at your macula and fovea. So according to the fundoscopy exam, I didn't see any abnormalities of the optic disc. So there was no blurry outline, it was clear, and there was no pallor, there was no hemorrhaging that I noticed in the retina, so no issues there. We're
Awesome.
going to go ahead and do a visual acuity test. So for this exam, I want you to close one of your eyes, so just cover it with your hand. Okay, yeah, there you go. And I want you to read the lowest line that you can read clearly. Do you wear any glasses or corrective
I don't.
lenses? No? Okay.
Do I just choose the smallest?
Yeah, the lowest line that you can see clearly.
Okay. 9, 3, 7, 8, 2, 6. Should I keep going?
Yeah, keep going.
W, M, E, X, O, O.
Good, okay.
4, 1, 20/25.
Good, alright. Can you move to the line below that?
4, 2, 8, 7, 3, 9, E, W, M, 0, 0, X.
Okay, perfect. So that eye is 20/20 vision. We're going to check the other eye now.
Okay.
And I want you to read the lowest line, the actual lowest line backwards this time.
Okay. 9, 3, 7, 8, 2, 4.
Go out here.
M, W, E.
Perfect. Okay, 20/20 vision in both eyes. It's amazing. So no issues with the optic nerve. Let's check your peripheral visual fields, because you did say that sometimes you get blind spots from your
Right.
migraines. Right now you don't have a migraine though.
No.
Okay. So what we're going to do is, if you can just face me. So this is the peripheral visual fields test. We're each gonna cover this eye right here, so that one. Go ahead and you're gonna stare into this eye. Let me know when you see the tips of my wiggling fingers.
Okay. I can see it.
Okay.
No.
Okay.
No.
Good. So we're gonna stick to that eye. Just trying to see, can you see it up here?
Sorry, one sec. There. Yeah.
Okay.
I can see it.
Okay.
No.
Good. Switch eyes. Okay, we're going to start up here. Can you see it? Stare at my eye. Can you see it?
No. Yeah.
Can you see?
No.
Good.
No.
Okay.
No.
Good.
No.
Good.
No.
Okay, perfect. So no peripheral visual field defects that I've noticed. That's very good. All right. So the next test is the H test. I'm going to have you stare at the tip of my pen here and just follow it with your eyes. Don't move your head. Okay. Good. Is the light bothering you?
No.
Okay, so no photosensitivity. That's very good. Okay, good. So that one we're testing cranial nerves 3, 4, and 6. Next we're going to test cranial nerve 5. So, okay. For this one, I want you to clench your teeth. Good. Unclench. Clench your teeth. Unclench. And clench again. Okay, very good. While we're here, I'm going to test your cranial nerve 11 as well.
Okay.
So that's the sternocleidomastoid. I want you to turn your head like into my hand here, like kind of resist it. Good. Other way. Very good. And I want you to shrug into my shrug into my hands. Okay. Lastly, the jaw. Can you kind of like waggle your jaw from side to side? Okay. And now push it into this hand here. Okay. And then this hand. Okay. Now we're going to be doing some sensory testing for your cranial nerve 5, trigeminal. So I want you to close your eyes, and this is a sharp sensation, this is a dull sensation. I want you to tell me if you feel sharp or dull and where you feel it, so point to where you feel it, okay?
Okay. It's dull.
Where do you feel it?
Right here.
Good.
Sharp. Here. Dull here.
Good.
Dull here. Dull here. Sharp.
Okay.
Dull. Sharp.
Okay.
Dull. Dull.
Okay, very good. Trigeminal sensory function is intact. Okay. Next we're going to test the facial nerve. So for this one we're going to do some silly expressions, okay? So
Okay.
first I want you to show me your teeth like this. Good. Puff out your cheeks. Good. I want you to wrinkle your forehead like this. Okay, very good. What else? I think that's pretty much it. Yeah, good to go. Alright, now we're going to do some taste testing. So So I want you to close your eyes again.
I hope it's pieces.
I'm gonna be right back. Okay. Ozzy, now we're gonna do some taste testing. So I want you to close your eyes and let me know what you taste. Open up your mouth. Like, what flavor is it?
I'm not sure.
Like, is it salty? Is it bitter, spicy, sweet?
It was a bit spicy.
It was a bit spicy. Here.
That's bitter.
Okay. Alright, just make a note of that. You can open up your eyes now. Okay. Alright. Next, we're going to do your auditory exam. So we're just checking to see if your vestibulocochlear nerve is working well. I'm going to be striking this tuning fork and then placing it on the top of your head. I want you to tell me if you hear it on the right side first, the left side first, or both sides at the same time, okay?
Okay. Same time.
Now I'm going to strike this tuning fork again, place it on your mastoid process. Let me know when you stop hearing it. I'll bring it forward. Let me know if you hear it and when you stop hearing it, okay?
Okay.
Let me know when you stop hearing it.
I can still hear it.
Okay.
It's over.
Do you hear it?
Yeah, loud and
Okay.
clear.
Close your eyes. Let me know when you stop hearing it, okay?
Stop.
Other side. I'm gonna strike it this way. It's not a...
It's over.
Do you hear it?
Yeah.
Close your eyes. Let me know when you stop hearing it.
It's done.
Okay, no issues with the vestibulocochlear nerve. Okay, so for this one, I want you to swallow. Okay, go ahead and swallow. Okay, now open up your mouth and say ah. Can you open it up larger and say ah again? Okay, good. So that's it for that. Symmetrical swallowing. And uvula is midline. Okay, pharynx. Did that test already, so we're gonna do the tongue. So I want you to like show me your tongue.
Okay.
Go ahead. Okay, and then move it from side to side. Okay, very good. And you don't have any trouble speaking either. Okay. Alright, now we're going to be checking your gait. Okay, I want you to walk just normally, slowly. Good. All the way here and then back. Okay. Now I want you to walk heel to toe. So like this. Heel to toe. Back. So put your heel like in front of your other toes.
Oh, okay.
Yeah, There you go. See if you can keep balance. Are you having some trouble?
A bit.
Okay. No worries. Alright, and then just stand here. Alright, so I want you to raise your arms like this. Okay. Now I want you to close your eyes. Okay, very good. You can open your eyes again. You can sit down. Alright, next we're going to do some coordination tests. So I want you to use your finger. So let's use this finger, your index finger, and touch my index finger, and then go back to your nose, and then come back to my index finger. We're going to go a little bit faster, okay? Go back to your nose, index finger. Okay. Alright. Keep going. Okay. Okay. Alright, very good. Now I want you to do a heel to shin maneuver. So what you're going to do is just bring your heel, bring it up to the shin, and then just keep switching.
Yes.
Your heel on top of your shin, like this. Okay, good. Good. Okay, now we're going to do your hands. So I want you to do this, and then keep going faster and faster. Okay, very good. Okay, I'm going to check your myotomes. So we already checked your shoulder shrug, so that's good. If you can just turn to face me slightly. Thank you. I want you to always resist against my touch.
Okay.
So go ahead and resist. Okay, resist, and then bring this up. Resist, resist. Good. Now I want you to grip my hands as hard as you can. Very good. Okay. So that's it for that. I want you to turn back again this way. And you can put your hands down on the table, both of them, because you're underneath them. Now resist. Yeah, so just move up, both of them, if you can. Good. Okay, you finish. Alright. Okay, Ozzy, so I'm going to be checking your vibration. If you can close your eyes, let me know when you feel the vibration, when you stop feeling it, okay?
Okay. I could feel it. It's gone. I feel it. It's gone.
Okay.
Yeah, I can feel it. It's done. I feel it. Nope, it's gone.
Good.
I can feel it. It's done. Yeah, I can feel it. It's gone.
Alright. Okay, so now I'm just going to check your deep tendon reflexes.
Okay.
So I just want you to relax as much as you can. Very good. Okay. Good. And then we're going to check a few more over here. So just relax again. Relax. Okay. Relax. Okay. Can you just put all your weight down? There you go. Good. Second. Good. And just going to turn off this. Okay, right, Ozzy, how are you feeling?
A bit worried,
A
but
bit worried?
okay, yeah.
Okay. So for the most part, your tests all came back negative. There's a few things, like for example, a taste that you didn't quite get, but not everyone gets that. So the next step we're going to do is do a brain MRI and electroencephalography. We're going to do that right away for you, no wait time. I'm also going to have you fill out some questionnaires. about like verbal memory, verbal fluency test. We're also going to draw some blood. Is that okay?
Yeah.
We're going to do a CBC electrolyte panel. We're also going to check your clotting factors just to see if there's any potential that this could have been caused by a stroke.
Okay.
But because of your age and because you don't have any history of any potential risk factors for stroke, I think it's more so transient global amnesia. This is my working diagnosis right now, but again, we have to rule out everything else. Okay. Do you have any questions for me?
No. I'll look forward to figuring it out.
Okay, we'll see you very soon. I'm just gonna get all of the lab work and everything ready to go, and then we can just get you right in there, do all the labs, and make sure you're okay.
Awesome. Thank
All
you
right.
so much.
Thank you so much
Appreciate
for coming in.
it.
Take care.
Bye.